Hello everyone, welcome to my YouTube channel. In this video today I'm going to speak about osteoarthritis. Well, osteoarthritis is degenerative disease that affect the joint. So in this video I'm going to speak about it, and I'm going to speak about the causes of osteoarthritis, risk factors, clinical presentations, and so many things about it. So osteoarthritis, as you can see, osteoarthritis, osteo means bones, then arthritis means like joint, then this itis means inflammation. So when you combat it, means inflammations of the bones, inflammations of the joints, I mean in the bones also. So it's also known as wear and tears of the joint, wear and tears of the joint or condition. It's also known as inflammatory condition like rheumatoid arthritis, which is RA. Arthritis. And it occurs in the synovial joints also. In the synovial joints. Synovial joints, which is the combinations of, number one, we have knee joint, then we have hip joint, which is hip joint, and also affect the sacroiliac joints. Sacroiliac. So, and is the combinations of genetic factors and overuse with injury to the joint. So I'm gonna show you how it is. Firstly, combinations of genetic factors. Number one, we have genetic factor. Well, these genetic factors is occurs, suppose like a family member in our family members, suppose who have osteoarthritis, are more likely to develop with this condition also. Like people who have OA, means osteoarthritis, they are more likely to develop with this condition. Then number two, we have overuse, like using, it could be using the same bones, using the same joint, the same joint over and over in a job. It will make you to affect with osteo. It will cause more pain and severe, or it will cause more pain in the osteoarthritis also. Then number three, we have injury to the joint. This injury to the joint, number three, it could be like in sport. Suppose those who are playing football or cricket or basketball or any kind of sport, athletic sport or badminton and so on and so forth. So during the time that you are in the sport, like let me talk take like football first. So when you are playing football, there is some injury that used to occur in the pitch. So in that case, it will cause osteoarthritis also, and there is trauma, which is road traffic accident, like accident which it is going to occur in the road. So due to that accident, it could be like maybe fracture or cartilage or ligament tears, and this can result the osteoarthritis also. It can result the OA. So we have to be aware of it. Then is told to be the result of imbalance. The result of imbalance between the imbalance. Number one, we have cartilage. Cartilage will wear down. Then we have chondrocyte, number two. Chondrocyte. So this led the structural issues. In the joint. Structural issues. This led the structural issue within the joints cause more wear and tears, pain in the joint, and it could be inward or outward, or this could be increase and this could be decrease of angle, which is genubarum and genubulbus in the knee joint. You could be able to see some people, sometimes the angle will cover like this. It will be internally or externally, inward or outward. So this abnormality, it could be seen in the x-ray. This abnormality could be seen in x-ray. The key mnemonic for seeing this x-ray is suppose let me make a small diagram of knee. Suppose this was knee joint. This knee joint. So in this side, suppose let's say this is the knee joint first, and the abnormality, it could be the key mnemonic for seeing this x-ray is LOSS, which is the formula is LOSS. This L stands for loss of joint space, loss of the joint space. The joint space become narrowing, and this bone come close to each other like this. The bone will come close to each other first. Number two, we have osteopathy. Osteopathy is a little space in the bones come out of either range of the joint. I mean, we could say, like, suppose this is the joint. In this side, you could see some little space of the bones come out of either range of the motion, which we call it bone spot, which is overgrowing of bone in the joints. Suppose then this number three, we have subarticular sclerosis. subarticular sclerosis. This is the density that it is increase the density of the bones, like increase the density of the bones along the jaw line. Suppose this is the jaw line here. It will increase the density of the bone along the jaw line and where the bones come contact with each other. So then number 4 we have subchondrocyte. Subchondrocyte. This subchondrocyte is some fluid fills whole the bones. Is some fluid like this. You could see it in the cartilage near this side. This fluid is like a grease, or how can I say, like a gum. So this fluid hold the bones in a jaw line. You could see the fluid like this, and when this fluid have become weak, it will be cracked. And when this fluid become weak, you will now something will not happen, which is crevitus, and the bone will come close to each other. It will be contacting. You will start hearing some sound in your joint, and this sound that you are hearing is due to the weakness of bones and the fluid that have already been weak also. So it will now be, when this fluid be weak, there's no functions or no any flexibility of movement. You will start at any time when you are walking, suppose in knee joint, when you are walking, you will start some hearing some sounding in your bones, and you will feel some swelling, pain, and sometimes stiffness also. Then the risk factor of this osteoarthritis, I'm gonna show you it's some risk factor of OE. Number 1, we have obesity. This obesity are the risk factors of osteoarthritis and it will be more commonly affect in the knee. And some advice like I'm going to give is like losing more extra weight in your joint are more important for those who have obesity, because sometimes you could see some people they are too fat. So due to the fat and maybe some things that we used to eat and lack of exercises and some fitness, it will be able to cause this osteoarthritis also. Then number 2, we have age. This age Number 2, we have age. This is age are like 50 to 60 years, because the older you are, the more repetitive stress you will get in your bones, which is due to the age factors. Sometimes when you reach to 50 years, so all your bones, it could now start being weak due to the age factors. So in this case, it will now happen. Then number 3, we have trauma to the joint. As I was saying earlier before, trauma to the joint, it can happen in maybe in an accident of cars or sport incidents, or maybe cartilage that was surrounding the bones there, it will now be broke, or the ligaments that will now help the bone to the bones, it will now be tears. So due to the tears of ligaments, it will now cause the trauma in the joint also, and the arthritis, it will be occur inside. So we have to be more aware of this also. Then number 4, we have occupation. We all know occupation. So occupation is particularly a job that will make you to twist your joint, or any kind of joint in your body, like maybe ankle joint, knee joint, or hip joints, or sacroiliac joints. So due to the due to the occupation, you will now be get these conditions also. Then number 5, we have family history. This family history, it could be particularly parent or sibling also. Then number 6, we have female. One more thing about this, female having higher rates of osteoarthritis than men, in as the way that researchers have already said. So then I will now speak about the presentations of it, which is clinical picture of OA. Presentation of OA. Number 1, we have joint pain and stiffness. Joint pain and stiffness intends the worst of activities contracts the inflammatory arthritis, where the activities, it could be worst and activities, where the activities tends to improve the symptoms of OA also. Number 2, we have deformity of joint. As I was saying earlier, deformity, it could be like weakness of, before I tell it, like maybe in the knee, you will now see some people, their knees have already bent like inward or outward. So you will see the angle have already changed. There is change in the rate of in the change in the knee or alignment or structural issues also. Then number 3, we have number 3, we have numbness or weakness in the joint. Sometimes we feel there is lack of coordinations or balance, or it could be sometimes reduce of functions also. So I think that's all for for today's video. In our next video, I'm gonna speak about the treatments, exercises, and the preventions also, how you can protect yourself with this condition also. Thank you for watching our videos, and don't forget to like and subscribe my YouTube channel also. See you in the next video. Thank you so much.